Hello, dear listener. Welcome to today's episode of Healthy Living for Seniors. I'm so glad you're here with me. Today, we're going to talk about a topic that affects many older adults: diabetes. But more than just talking about what diabetes is, we're going to gently explore some of the common misunderstandings, things to avoid, and mistakes people often make without even realizing it. If you or someone you love is living with diabetes, I want you to know you are not alone. And there is no shame in not knowing everything. That's why we're here together, to learn, reflect, and feel more confident in managing our health. So let's begin. What is diabetes? Simply put, you might already know this, but it's always helpful to start from the beginning. Diabetes is a condition where your body has trouble managing sugar, or glucose, in your blood. Now, sugar isn't just what we get from sweet foods like cakes or cookies. Our body also turns carbohydrates like bread, rice, or fruit into sugar for energy. Here's what usually happens. When you eat, your body uses a hormone called insulin to help move sugar from your blood into your cells, where it can be used for energy. But with type 2 diabetes, which is the most common type in older adults, your body either doesn't make enough insulin, or your body doesn't respond to insulin properly. This is called insulin resistance. As a result, sugar stays in your blood instead of going into your cells. Over time, too much sugar in the blood can cause damage to your eyes, kidneys, heart, nerves, and even your brain. But here's the important part. Diabetes is manageable. With the right habits, support, and understanding, you can live a full, active life. Let's talk about something that many people, especially older adults, often believe: I feel fine, so my blood sugar must be fine too. It sounds reasonable, doesn't it? If there's no pain, no dizziness, no trouble seeing or walking, we might assume everything's working well inside the body. But with diabetes, especially type 2 diabetes, this is one of the most dangerous misunderstandings. You see, high blood sugar doesn't always cause symptoms right away. In fact, some people can live with high blood sugar for months or even years and feel completely normal, until one day something serious happens, like vision problems, nerve pain, kidney issue, or even a stroke. Let me give you a gentle example. Imagine you're driving a car, and the engine light comes on, but the car still drives smoothly. No noise, no strange smells, no shaking. You might ignore the light, but inside the engine, something is slowly wearing down. By the time you notice real trouble, the damage might already be big. That's exactly how diabetes can work. Blood sugar might be high, but you may feel just fine. That's why we don't rely only on how we feel. Stethoscope. So what should we do instead? Check your blood sugar regularly, even if you feel okay. If your doctor gave you a meter, use it. If you don't have one, ask about it. Tracking numbers helps catch problems early, before you feel them. Get your A1C tested every 3 to 6 months. This is a simple blood test that shows your average blood sugar over the past few months. It's like a health report card for your blood sugar. Listen to your body, yes, but also listen to your numbers. Feeling fine is good, but knowing your numbers? That's even better. Blossom, a gentle reminder. Having diabetes doesn't mean you have to feel sick all the time. Many people with diabetes live full, active lives. But it also means we have to care for ourselves before symptoms appear. That's the key to staying strong, clear-minded, and independent. So if you've been thinking, I don't need to check, I feel fine, please take a moment to rethink that. Checking your blood sugar isn't a sign of worry. It's a sign of wisdom, a sign of care, a sign of self-respect. Now, let's talk about another common belief. Diabetes is just about sugar. I just need to avoid sweets. If you've thought this before, you're not alone. Many people, including well-meaning friends and even some caregivers, believe that diabetes is simply about not eating sugar. And yes, of course, limiting sugar is important, especially added sugars like what we find in sodas, candies, pastries, and sugary drinks. But diabetes is not just about avoiding sweet foods. It's really about how your body handles all kinds of carbohydrates. Bread. What are carbohydrates? Carbohydrates are found in bread, rice, pasta, potatoes, corn, fruits, even milk and yogurt. When we eat these foods, our body breaks them down into glucose or sugar to use for energy. So even if you never eat cake or candy, you can still have high blood sugar if you're eating too much of the wrong kinds of carbs or not balancing them properly. Fork and knife with plate, a simple way to think about it. Let's picture your plate. If most of your plate is white rice and bread, and just a little bit is vegetables or protein, your blood sugar may rise a lot, even though there's no sugar in sight. But if you balance your plate, maybe half vegetables, a quarter protein like chicken or fish, and a smaller portion of rice or potato, your body handles it much better. It's not about cutting everything out. It's about balance and portion size. Glowing star, what you can do. Don't just avoid sugar, learn to balance meals. You don't have to fear all carbs, but learning which carbs and how much makes a big difference. Focus on fiber. Foods like leafy greens, lentils, and whole grains slow down sugar spikes. Include protein with your meals. Eggs, fish, tofu, or chicken help your body feel full and steady your blood sugar. Talk with a nutritionist if you can. Even just 1 or 2 sessions can help you feel more confident with your food choices. Speech balloon, a gentle thought. Avoiding sweet foods is a good start, but managing diabetes takes more than that. It takes understanding, balance, and a little planning. The good news is you don't have to give up everything you love. You just have to learn how to enjoy it wisely. Let's take a moment to talk about another belief that sounds comforting at first. I'm taking my diabetes pills, so I'm fine. The doctor gave me insulin, so I don't need to change anything else. If you've ever felt this way, I understand. It can feel like a relief to have a pill or a shot that takes care of the problem. And yes, medications are important. They're part of the plan. Sometimes they're essential. But here's the truth. Medication is only one piece of the puzzle. And without the other pieces like food, movement, sleep, and stress, that puzzle stays incomplete. What medications can do and can't do. Medications can help lower blood sugar, support insulin levels, reduce complications, but they can't eat healthy for you. They can't go for a walk for you. They can't help you sleep better at night. They can't calm your stress or reduce inflammation from daily habits. And sometimes, if we rely too much on pills, we miss the chance to improve naturally, maybe even reduce the amount of medication we need. Woman running medium skin tone, small habits, big impact. Research from doctors like Peter Attia and Rhonda Patrick shows that simple lifestyle changes can make a bigger difference than many people expect. Here are a few examples. A 10-minute walk after meals can lower blood sugar for hours. Replacing white rice with half cauliflower rice or barley can reduce sugar spikes. Getting just 30 more minutes of sleep each night can improve insulin sensitivity. Practicing slow breathing or light stretching can calm stress, which helps your blood sugar too. You don't have to change everything overnight. Just start small and stay steady. Herb gentle encouragement. Taking your medicine is a sign of responsibility. But taking care of your body beyond the medicine, that's a sign of wisdom and long-term healing. You are not just managing numbers. You're caring for your whole self. Let's aim to combine medication with better daily choices, so your health isn't just managed, but truly supported. Now, let's talk about something that brings a lot of quiet fear to many older adults living with diabetes. If I need insulin, does that mean I failed? Isn't insulin only for people with really bad diabetes? Does starting insulin mean I'm getting worse? If these thoughts have ever crossed your mind, take a deep breath. You are not alone. Many people, especially those who were doing well with pills for years, feel upset or even ashamed when their doctor mentions insulin. But let me tell you something important. Backhand index pointing right, needing insulin is not a failure. Backhand index pointing right, it is not a punishment. Backhand index pointing right, it is simply a tool. Like glasses to help you see better, or a cane to help you walk safely. DNA, why some people need insulin. As we age, our body's ability to make and use insulin can change, just like our eyesight, hearing, or joints. Sometimes the pancreas, the small organ that produces insulin, gets tired or damaged over time. It might not make enough insulin, even if you eat well and stay active. This is not your fault. It's part of how the disease can progress. So, insulin is not about blame. It's about supporting your body in the best way possible before more serious problems happen. Syringe modern insulin, easier than you think. Today's insulin is often delivered in tiny, easy-to-use pens, not big scary needles. More precise with fewer side effects than in the past. Sometimes used just at night or once a day, not always before every meal. And many people feel better, more energetic, and clearer in the mind after starting insulin because their blood sugar finally stabilizes. Yellow Heart reframing the mindset. Instead of thinking, "I'm getting worse," try thinking, "I'm taking a powerful step to stay strong. I'm giving my body what it needs. I'm choosing quality of life." Insulin is not the end of the road. For many, it's the beginning of better control and more freedom from complications. Tulip, a gentle story. A woman named Mary, age 76, once told me, "I was scared of insulin for years, but when I finally started it, I realized I had more energy, fewer bathroom trips, and I could think more clearly again. I just wish I hadn't waited so long." So, if your doctor says it's time to consider insulin, don't panic. Ask questions, get support, and remember, you are not failing. You are adapting wisely. Let's explore a common habit that sounds like a good idea, but can actually backfire, especially in older adults with diabetes. I skip meals to keep my blood sugar low. If I don't eat, I won't raise my sugar, right? It may seem logical, less food means less sugar, right? But when it comes to diabetes, our body's response is more complex than that. Skipping meals, especially breakfast or lunch, can actually make blood sugar go up, not down. And in some cases, it can even lead to dangerously low blood sugar later in the day. Let's break this down gently. Brain, what happens when you skip a meal? When you go too long without eating, your body thinks, "I'm not getting food. I need to release sugar from my liver." So your liver, trying to help, sends glucose into your bloodstream. But because your insulin isn't working properly, which is the case in type 2 diabetes, that sugar stays in your blood and your numbers go up. Now, if you later eat a large meal after skipping, the sudden sugar load can cause an even bigger spike. This creates a roller coaster of highs and lows, which can leave you tired, dizzy, and confused. Fork and knife with plate, why regular meals matter. Eating regular, balanced meals helps your body stay steady, no big sugar swings. Use medication more effectively. Avoid hunger-driven overeating. Maintain muscle and brain health, especially as you age. Skipping meals also increases the risk of low blood sugar, especially if you're on insulin or certain pills, falling, fainting, or feeling confused. Losing weight in an unhealthy way, including loss of muscle, which is dangerous for older adults. Bowl with spoon, what you can do instead. Eat small, regular meals every 4 to 6 hours is a good rhythm. Never skip breakfast, even something simple like oats, eggs, or plain yogurt can help. If your appetite is low, try nutrient-dense snacks, like a banana with peanut butter, or a boiled egg with whole grain toast. If you feel full quickly, eat smaller portions more often. And always talk with your doctor or nutritionist if you're unsure what to eat or how much. Speech balloon, a gentle reminder. Skipping meals may seem like a shortcut to lower blood sugar. But for people with diabetes, it's more like taking a wrong turn on a road you know well. Don't punish your body by starving it. Nourish it, support it, respect it. Your body needs steady fuel, not extremes. Today, let's gently explore another area that comes up often when I talk with older adults managing diabetes. I heard bitter melon lowers blood sugar. My neighbor drinks cinnamon tea every morning. She doesn't take any pills. I'm using herbal medicine instead of drugs. It's natural, so it must be better. Now, I want to begin by saying this clearly. There's nothing wrong with being curious about natural remedies. Many herbs and traditional foods have real health benefits, and some may support blood sugar control to a certain extent. But the problem is when we rely on these remedies alone, or worse, stop taking prescribed medications in favor of natural solutions without telling our doctor. That's when things can become dangerous. Herb the promise and the limit of home remedies. Yes, bitter melon, cinnamon, fenugreek, okra water, aloe vera, these and other plants have been studied, and some show modest effects on blood sugar. But here's the key. They may help, but they are not cures. And most of the time, the effect is too small to replace the role of prescribed medications, especially when diabetes is more advanced. Also, not all herbal products are safe. Some can interact with medications, stress the kidneys or liver, cause unpredictable side effects, especially in older adults. And unfortunately, many natural products sold in markets or online have no quality control. We don't always know what's really in them. Test tube what experts like Dr. Rhonda Patrick recommend. Health researchers like Dr. Rhonda Patrick emphasize the importance of science-backed, whole-body approaches to chronic conditions like diabetes. Herbs may be part of your toolkit, but they should complement, not replace, medical treatment. Any natural supplement should be used under medical supervision, especially for older adults. Stethoscope, a gentle example. I once heard a story of an 82-year-old man who stopped taking his pills after starting a homemade herbal drink. He felt fine for a while, but slowly his blood sugar climbed. He didn't notice until he ended up in the hospital with blurred vision and fatigue. He wasn't foolish, he just didn't realize how slowly high blood sugar can cause harm. This is why we must never replace medication without clear guidance. Person in lotus position, what you can do with natural tools. Use herbs like cinnamon, turmeric, or bitter melon as part of your meals, not as medicine. Drink herbal teas if you enjoy them, but don't expect them to replace your pills. Focus on whole foods, fiber, sleep, and light activity. These are natural therapies with very strong evidence. Always tell your doctor if you plan to try any herbal remedy, so they can help you stay safe. Speech balloon, a loving reminder. It's good to seek gentle, natural ways to care for your body. But nature and medicine don't have to fight each other. They can work together. Let your care be wise, not just well-meaning. Use what's helpful and always protect your health with knowledge. Let me ask you a quiet question today. When was the last time you checked your blood sugar? Some of you might say, this morning, and that's wonderful. But many others might say, oh, I only check once a week. Or, I don't check because I feel okay. Earlier in this podcast, we talked about how you can feel fine even when blood sugar is high. Today, let's go deeper into why checking regularly and understanding the numbers is so important. Chart decreasing, why checking matters. Even when you feel okay, your blood sugar levels are like your body's silent language. They tell a story, one that your eyes, skin, or energy levels might not reveal right away. Without checking, we don't know if your medication is working well, if a new food is affecting you, if your sugar drops too low at night, or if you're slowly creeping toward dangerous highs. Regular checks help catch patterns, not just numbers. And patterns help your doctor make better decisions for you. Open book, understanding the numbers, made simple. Let's go over a few basic numbers in a simple way. Fasting before breakfast, 80 to 130 mg/dl is a healthy range. 1 to 2 hours after a meal, less than 180 milligrams per deciliter is generally the goal. Bedtime, 100 to 140 mg/dl is considered safe for many older adults. Now, everyone's targets may differ slightly, especially as we age, so it's important to ask your doctor what range is right for you. But here's the thing, one high number doesn't mean failure, and one low number doesn't mean everything's perfect. What we care about is the trend, the overall picture over time. Clipboard, common mistakes to avoid. Only checking once a week. That's like reading one page from a long story. Forgetting to write numbers down or not bringing them to your doctor visits. Panicking over small ups and downs. Blood sugar is naturally flexible. Comparing your numbers to your friends. Every person is different. If you don't like pricking your finger often, ask your doctor about continuous glucose monitors, CGMs. Small devices that check sugar all day, often without finger sticks. Brain, why this matters more with age. As we grow older, we may be more sensitive to low blood sugar, more at risk of falls or confusion from sudden drops, taking more medications that affect glucose. That's why tracking is even more important, not less, after age 65 or 70. Speech balloon, a kind word. Checking your blood sugar isn't just a task. It's a form of listening to your body, to your health, to your future. Even if the numbers aren't perfect, they are powerful information. And you deserve to have that knowledge in your hands. Let your blood sugar meter be a friend, not a burden. Because knowledge is not fear, it is freedom.